I'm sorry, you're supposed to give me a 5, 4, 3. Are we recording? Okay. So we want to do a little in-service to educate the nurses how to do a TUG assessment effectively. Part of our fall's QAPI plan is to be doing more effective fall risk screenings and using the fall risk screenings that we are already doing more effectively. So the first part of that is when we go through the Mach 10 that we have to go through as part of each start of care assessment, the nurse really needs to look at each piece of that and every risk factor that's on that Mach 10 screening that they identify as being part of their something that they could address. So medications, referrals to address any visual deficits, environmental hazards, pain, things like that that are really potentially interventions that a nurse could provide. They need to be doing that. The other part of that is we need to be effectively determining whether or not therapy is needed if therapy is not already ordered. So to that end, we're asking if the nurse is doing an open and there's no therapy ordered, we're asking that if the Mach 10 assessment indicates the patient scores 4 or higher and that they're fall risk, that they go ahead and perform a TUG assessment to determine if therapy is warranted, if a referral for adding PT onto a case is warranted. So the TUG assessment is also, in addition to that, it's a really beneficial way to streamline the functional assessment that we're required to do for the purposes of determining somebody's functional scores on the OASIS assessment. If you do just a TUG assessment, you really can infer all of the data that you need for each of those ADL questions. So let's see here. So in NetSmart, this is located under the environment safety subsection. It's right next to where the Mach 10 is located. And it's currently activated. So if for whatever reason you're not going to be performing a TUG assessment, either PT is already ordered, if therapy is ordered, it's not required that we do a TUG assessment because that's the purpose of the nurse doing the TUG assessment. So if PT is ordered, you don't have to do the TUG. If the patient's unable to safely perform, if they're non-ambulatory or they are ambulatory but it really requires a lot of assistance, you can indicate that on the TUG assessment. There's an option to select unable to perform safely, or you can hit other and just fill in not evaluated or not indicated. But again, even if therapy is ordered, it's a really good idea to do a TUG assessment because of the fact that it supports your functional ADL scores and it allows you a more thorough functional assessment than just interviewing the patient. Also in NetSmart, the instructions for the TUG assessment are outlined really, really well, and it's really clear if you look at that tab in NetSmart, it's really clear where the cutoff scores are if somebody is a fall risk or not. And really the cutoff for that is 14 seconds. If they take longer than 14 seconds to perform the TUG, they're considered high risk for falling. So we're going to start off here with our volunteer. I always recommend using a gait belt if you've never seen somebody walking before. However, if you have to actually intervene and provide physical assistance, that would invalidate the TUG assessment, but that would also automatically indicate they're unstable during their gait and they would likely benefit from PT. But again, it's a good idea to have a gait belt. If you don't have a gait belt, talk to your office about getting one, or if anybody has an extra one you can use, it's a really good idea to have that on the patient. Have them seated in a firm chair. So if they only have chairs in the kitchen or like office chairs with wheels, you need to back it up against the wall so it doesn't slide out from under them when they go to push up. It's also a better idea to have them in a chair like this with armrests than doing it in a couch. The couch is usually too low and kind of too cushy to really effectively evaluate the TUG assessment. So we'll have them in our firm chair backed up against the wall with the gait belt on and with their normal assistive device available to them to use. Right? And then I'm going to use a tape measure to measure out 10 feet. If you're doing this routinely and you don't have a tape measure, you can just pre-measure rather, and cut a piece of string that's 10 feet long and just keep that in your bag somewhere. And I'm going to start the measurement from right in front of her foot. So as opposed to from the seat surface, I'm going to measure it right from the beginning of her foot. So go ahead and lift your toes here, Kristen, and then just hold the tape measure for me. So I'll measure off 10 feet with my string or my tape measure. Go ahead and let go. And then I'll just leave my tape measure here so she can see where our target is. And then it's just as easy as explaining, well, Kristen, when I say go, I'm going to have you stand up, walk even with the tape measure, turn around, and sit down. And then I'm going to start my stopwatch as soon as I say go, not when she starts to move, because her reaction time is part of the assessment. So, are the instructions clear?
Yes,
all right.
they are.
Ready? Go. She's going to walk, and while I'm timing, I'll be in a position where I could provide assistance if I needed to. And I will stop as soon as she sits down. So I start as soon as I say go, and I stop as soon as she sits down. Now, if for whatever reason, sometimes people start talking during the test, or they stop and they're kind of confused and they take a little longer just because they didn't understand the instructions, just do it again. If somebody says, well, you know, they stop and just start conversing with you, just have them redo the assessment. You can do it up to 3 times, and I would just throw out that first test. Let's see, anything else we need to mention? So as far as how we use this, again, we're asking the nurses if a patient scores above a 4 on the MAC-10 to perform the TUG assessment. If they take longer than 14 seconds on the TUG assessment, that warrants a referral for PT. If it's not necessarily, the therapist may use a TUG assessment as a goal of decreasing their risk for falls. We're not asking nurses to write a goal around that, but it is a good idea to relay your score to the therapist so that in the event that there's a drastic difference in scores, the therapist may be able to document why that might be. But essentially that's it. It's pretty straightforward. And again, the instructions in NetSmart are pretty thorough as well. So that's it.